There has been some recommendations for individuals, even if they're feeling healthy, to wear masks. So we've been getting those questions into our newsroom as well.
Yeah, so that's actually a change from what the CDC was originally saying. That includes using these surgical or paper masks. It is now recommended that you do that. It probably is not terribly helpful, but it probably is more helpful than not.
So regardless if you're symptomatic or you're feeling healthy, you should wear a mask.
Correct, one of these surgical paper masks, but don't get an N95 mask unless you're a healthcare worker, because we really, really need them.
So if an individual gets tested negative or gets a result of negative, but is still symptomatic, what should they do?
Very good question. So in that case, and we're not having too many of folks like that, but in that case, I would recommend quarantining yourself for up to 14 days, or at least until 7 days after the symptoms started.
There's a projection that the federal government's going to run out of personal protective equipment, or already has in terms of its stockpile. Is that a large concern for the county?
Two of the things that are really distressing, and probably the two biggest problems that we've had with this entire outbreak, have been the lack of testing, which still is the case, and the lack of personal protective equipment, or PPE, which includes the N95 masks and gowns and visors, etc. And everybody around the country is fighting for a limited number of these types of equipment, and that's inexcusable. Most of it is very inexpensive. This is something we should have had in our stockpile, and it should have been readily available.